Colon cancer is the second most deadly form of cancer, and yet 60% of those deaths can be prevented by routine screening. At Cuyuna Regional Medical Center, those screenings are a priority. March is Colon Cancer Awareness Month, and so the push is on to get men and women screened.
So what is the screening for colon cancer? The gold standard screening that I always recommend to my patients is the colonoscopy. It's a camera study. So they're doing a direct visualization with the camera of your entire colon. If you've got polyps, they remove them right then and there. If there's anything that looks concerning or suspicious, they do biopsies.
So the nice thing is that it's a screening, it's diagnostic, and it's also preventative if there are polyps there and they can remove them. But they go all the way to the end and then back again, taking pictures the whole time.
Screening technology has advanced so much over the years, as has the overall ease of the procedure for the patient. But a more startling change has been the increase in earlier detections of colon cancer. Used to be when you turned 50, it was time to get checked out. Now that baseline age has lowered to 45.
It shows that we've been diagnosing colon cancer at earlier ages, and so it necessitates screening sooner.
But also know that if you have a history of inflammatory bowel disease like Crohn's or ulcerative colitis, that age is actually going to be younger. Or if you have a family history of colon cancer, that age is also probably going to be younger. So make sure to bring it up with your doctor.
If you have an opportunity to get one, then you should.
Amy Hart is walking the walk. The CEO of the hospital gives us a firsthand account of her screening.
If I can convince somebody out there who also has trouble talking about it or are worried about the procedure or those types of things, then I can convince them to get one. I know I've done my job.
The day before is probably the hardest day because you have to eat a liquid diet. The colon needs to be clean, so you have to take medicines to clean your colon. I tell patients you're gonna have one crappy day, no pun intended.
So if you haven't had one for 10 years even, the prep has changed and it's a whole lot easier. Our pharmacy here has a little bag, has everything in it. They check you in, you go back into the pre-op room and you change it to a gown. They do give you an IV, and because they want you to have some fluids. We use a medication called propofol here, and they just inject that into your little IV bags and you're out. It's over within that half an hour. It is the greatest nap you have ever had in your life. You're not really too groggy afterwards. It clears really fast. Get you dressed and off you go. They'll tell you if they think they found something. Fortunately for me, there wasn't anything.
That's good.
Yeah, so now it's 10 more years, if I don't have any trouble, is when my next procedure would be.
For those that work here, this push to get procedures done is personal. Many of them have experienced the serious effects as to just how vital screenings can be.
3 family members have had colon cancer in my family with 3 very different outcomes. And when they were following through with the screenings, it was a much better outcome. And my mother, who refused to do any screenings, passed away in May of 2022 from colon cancer.
My mother passed away from colon cancer in 1965. In those days, they didn't have the colonoscopy scopes, so it got advanced before they could determine exactly what it was. It was a pretty tough road for about a year and a half.
My daughter, Margot, she's 4 now. When she was 2 years old, she was diagnosed with a very rare condition called juvenile polyposis syndrome. So her little colon already is making polyps. And so she has had 3 colonoscopies in her life already. And a lot of patients will sometimes even just finish my sentiment and say, so you're telling me if your 4-year-old daughter can do colon prep and have the colonoscopy, I probably can too. And I'll say, yeah, I probably can.